If your baby needs a little extra help at birth with some resuscitation efforts or ends up needing to go to the NICU, I'm going to explain what some of these things are that are going on. So if you see it for the first time when you have a baby, you're not as scared or confused. So when your baby is born, we follow a very specific algorithm. This is called NRP, or Neonatal Resuscitation Protocol, and it tells us what to do when based on how your baby is doing. So if it's determined that we need to bring your baby over to the warmer, one of the first things we're going to do is put EKG stickers on. This helps us see what your baby's heart rate is. One of these things will go on their little footsies to monitor their oxygen. If your baby is less than 30 weeks, there's a good chance they'll be wrapped in this thing that looks like plastic wrap, but it's called a Neo Wrap, and it helps keep them warm and prevents them from losing that really important heat we want them to have. Now, if it's determined your baby just needs a little help with their breathing, needs a little oxygen, a little support, kind of open things up, we might do blow by, or we might actually apply this, but this is a bag valve mask. This is another thing that'll frequently get used. This is a CPAP, just again helps open all of the alveoli, airway, helps get that oxygen to baby. Now, if for some reason those things are not working and we need to progress to extra support, extra help, that's when they might put in an endotracheal tube. So this is the stylet they use to get that tube in. And this is what it looks like once it's in. If it's determined we need to give certain medications or blood or fluids to baby, then most of the time what we're going to do is put in a catheter, and it'll go through their little umbilical stump right here. Now, I know everybody is different, but I think for a lot of people could be helpful to see that if you do know your baby's maybe going to spend time in the NICU, or even if you don't expect them to spend time in the NICU, there's a lot of times the babies need a little PPV or a little support at delivery. And so seeing all of this stuff and knowing, oh, that's what that is, that can relieve a lot of anxiety for you if you know what they're doing and what it's for, what the reason is.